You're listening to The Physician's Mind, raw stories and real talks from people striving for greatness in medicine and in life. This is where ambition meets action and where the relentless comes to level up. I'm your host, Curtis Wilkerson. Thank you so much for listening. Let's get right into it. Hello, everybody, and welcome back to the Physician's Mind podcast. I'm your host, Curtis Wilkerson, and today I'm honored to be speaking with Dr. Taylor Reardon. Dr. Reardon, thanks for joining me, sir. How are you today?
Doing well, Curtis. Pleasure to be here. Pleasure and honor. I'm excited to, talk today about, my journey and any advice I can give and learn from you as well. I'm really, really excited for this.
Certainly. Thanks again. Can you tell us what initially drew you into medicine and why you chose neurology?
Initially, it started out with like a love and a passion for science in general. Going through high school, I had a biology teacher that was not only like an anatomy professor and cell biology teacher, but he was also the strength and conditioning coach for our football team. And I think that started out with an interest in, because I was an athlete in high school as well. And I said, well, I think it's cool that, you can be interested and be really, really dedicated to your sports, but at the same time be interested in science. And I looked up to him as a mentor and I said, well, I'm not really interested in anything else right now. So I said, I do want to do something in in the science field. And then going through, and I can get into like, why neurology specifically later, but, going through everything, it was more like it was just exposure to the different parts of science and being like, okay, well, I didn't want to do history. I didn't want to do anything with math, really. All the other subjects really weren't as interesting to me. So I said, this sounds like something I want to do. And then going into college, majored in neuroscience. And then I went to decide between PhD versus medicine and kind of went the medicine route.
All right. So were there any particular moments or experiences with patients that reinforced your decision to try for med school?
Yeah. So one of my favorite experiences, I think, was during college. I was thankful my hometown hospital allowed students who are interested in medical fields to kind of do an internship in the summers when they're not in classes. And I did 6 months as a nursing assistant in the ICU there, and got a lot of exposure from that role in healthcare. And then the following summer, I was a medical assistant in a joint neurology neurosurgery practice. And they knew I was interested in at least wanting to try to get into medical school. And the physicians there were so nice and so willing to teach me. And I think the first time I was ever exposed to a lot of, patient care was actually a neurosurgical experience. One of the neurosurgeons said, hey, I have an emergency cranie. Let's go and I'll let you watch. And, I was literally 20 years old at that time. And I'm like, oh my gosh, this is crazy. So, watching the cranie from that point on, I was like, yeah, this is, medicine is definitely what I want to do. It might not be neurosurgery, but, the impact that he made on this person that was, 100, that, was not doing well, and that they made almost a full recovery afterwards, minor deficits. It's like, this is incredible. So from that point on, I was like 20 years old. I'm like, yeah, this is exactly what I want to do.
Yeah, those experiences we have around that age range during the college years, those are always the cool ones that really lock it in. So can you share with us some of the challenges you faced as an undergrad trying to get into med school, and then really some of the challenges you faced as a medical student and how you overcame those challenges?
Yeah. So I'll separate those into college and medical school. So I think one of the things that was difficult, even starting out in high school, I know that medical school is getting tougher and tougher, and you have, individuals going to the best of the best private schools, and, they're taking college courses, and, they come into college with, half of their biology degrees completed. I didn't have that. I went to a very rural high school, graduated with 50 in my class, smallest division in sports, very rural area. So, we had a couple AP courses, but they weren't, the school wasn't really like geared towards creating medical or, academic powerhouses to get into medical school. Not saying you didn't have the opportunities, but I think that was a little bit more difficult. And then because of that, going into college, I had a little bit of a imposter syndrome because, I went to University of Toledo. So it's a Division I school versus being, 50 in my class. It was definitely a large population, and I realized like, hey, I got to work a little harder because some of these people are, man, they're brilliant. Being able to, interact, even my roommates, my roommates in college are anesthesiologists and dentists now. So, being around them really motivated me. And I said, man, I got to like pick it up. So I think a little bit of imposter syndrome during college was something that I came across that I had to overcome. And, the other thing too was I didn't really have a lot of exposure to medicine anyways prior to that experience. So some people are like shadowing, physicians in high school and getting in with that. And I just didn't really have that. And I think that was a little bit more difficult to overcome. But then once in college, it's the experience, right? You know exactly how it goes. You're in college and you're, trying to get good grades. You're a part of every single committee under the sun. You're also trying to do bench research or clinical research. And, as an undergrad, you're a data miner. You're going through all those chart reviews, or you're in the bench and you might not want to be there, something like that. So, balancing all of that was difficult. And then going through, preparing my application for medical school, I think I had really good extracurriculars, but my MCAT was not where I wanted it to be. And so I ended up retaking the MCAT. And so I was like, well, this is another, thing you have to overcome. And I just wanted it to be more competitive. And I wanted to make sure that when I applied to medical school, I gave it my best foot forward and gave it my all and made sure that I brought the best, package forward for admissions committees. So multiple things throughout my journey up until medical school, but I think that they all taught me different things each time. And I think that I've brought and took all of that with me being a physician.
Yeah. So once you overcame those hurdles getting in, what was it like once you were in? What were the challenges you faced in the first couple years? Were there any defining moments that made you think, yeah, I definitely want to go neurology? What was it like in med school for you?
Yeah. So, man, I guess for the listeners that might be wanting to get into medical school, I think the most common comparison to how medical school works is you drink through a fire hose. And because it's just information hitting you in the face and you have to retain as much as possible. And I was like, yeah, okay, sounds good. I didn't realize how much volume it was going to be. And then those first couple, block exams, you know how it goes. It hits you and you're like, oh my goodness, okay, this is not undergrad. This isn't even like undergrad plus. This is a whole new ball game. So I think it was just a matter of doing that and, being able to process the information instead of just trying to scarf it down and regurgitate it. In addition to, you have to do some, not as important as undergrad, I would say, but you still want to get involved in extracurricular things. So it was not only doing that, but at the same time, getting involved in research in your spare time and, also balancing, family life and relationships and all of that stuff when you're even busier. It was just a lot to deal with. And I think the only way that I was able to get better at it was just do it more and get better with time. Now, getting into neurology specifically, I have some family exposures to neuroscience in general. My grandmother had Alzheimer's, and my grandfather actually had a bout with Guillain-Barré syndrome. And from those pathologies, I was like, this is, it was incredibly sad to see both of them, but, it was interesting. I said, to me, I'm biased, but, neurology is one of those, mysterious fields. And when you go through medical school, you have those people that are like, I can't stand neurology or I love neurology. And that usually is how it goes. So I knew going into medical school, I was like, I really do like neuro, but like I wanted to make sure that studying the material was great and I was interested in it and I loved it. So since that time, I was gunning for neurology. And I actually, at one point, considered neurosurgery, given my exposure to working in an office. I really did enjoy neurosurgery, but I think my audition rotations and the research I was doing really was interesting. And I just, ended up in neurology, and I'm very, very grateful for that. So really just clinical experiences, research, mentors, all the things that shape medical students into the fields that they like. Really, that's really what guided me to neurology.
Yeah. Awesome. And real quick, what is Guillain-Barré syndrome?
Yeah, so Guillain-Barré syndrome is like it's normally it's kind of like a post-viral, I guess, syndrome where it's commonly seen after, if you, for those medical students out there, they think of like a bug called Campylobacter. So someone usually presents with, GI distress, some viral illness of some sort, and then they progress with ascending weakness of their legs, and it goes into their fingers and it attacks the nerves. It attacks the nerves and their ability to function. And the reason why this is dangerous is because it can attack the muscles that are involved in respirations. So it can have respiratory decompensation. So individuals who you're suspicious for Guillain-Barré, you have to admit them and you have to be careful and make sure that they don't have respiratory compromise. You have to monitor them with neuromuscular monitoring and make sure that the muscles that are involved in respirations don't get weak, because I've seen people have to be intubated because of Guillain-Barré syndrome. And then, you have to treat them with immunotherapies to try to clear the bad antibodies that are involved. And it's a long process and the recovery is variable. It favors the youth. My grandpa got it when he was 80 and he made a full recovery, which was incredible. It was honestly shocking from what I've seen now. I look at it every day and I was shocked. So it's an uncommon condition, but I've seen it a fair amount in residency so far, and I don't think I'll ever not see it again in training.
Interesting. Yeah, thanks for clearing that up. I was unfamiliar. Of course, I don't mean to be pimping you on the cam here, but I was curious. I had to ask.
You're good.
So, well, looking back, what would you say made your application competitive to the residency programs you applied to? What were some of your strong points as a medical student?
Yeah, absolutely. So a couple of the things that I think made my application strong, and this is just, I guess, general advice for anyone wanting to get into programs, where my clinical scores were good. My shelf exams were good. I wasn't in crazy, crazy high scores, but they were good.
Mm-hmm.
Making sure that, you pass your boards the first time is really important. I know that for you, it's now pass fail for the first exam, but when I took it, I took STEP and COMLEX. So I took 4 board exams in medical school just to make myself more competitive for larger academic institutions. So I did fairly well on those exams. I wasn't in, the 99th percentile or anything like that, but I did well enough to apply to, good programs. And I think that was something that helped. I think that having good extracurriculars, I was a class president for my class for 2 years. In medical school, I was involved in some of the neurology, neurosurgery interest groups. I actually was part of a leader of a neurology, neurosurgery research interest group that's still going on. It's called NERV, and essentially it provides research opportunities to individuals who don't have home programs that can pump out research and do really well. So I was really passionate about that because I didn't have that, and I was interested in research, and I wanted to make sure that other people had the opportunities that I had, and being a leader in that was really, really rewarding. And to go alongside that, I had a fair amount of publications going into application season. I think I had maybe 16 or 17 PubMed papers going into residency, which is a decent amount. But the other thing too that I think is important outside of all the stuff on the papers that you can write down is who you are as a person. Because when you do your audition rotations, and that's a critical thing as well, is going to do auditions at the programs you're interested in. When you do these, it gives people a month's insight into working with you. And I think what made it just as nice as the stuff on paper, or made up for things on paper, was your ability to interact with others and I hate to say it, but be a normal individual. Because it's, residency is a 3, a 4, a 5, it's a 7-year marriage to people. You're with them for 70 to 80 hours a week, and you don't want to be not a fun person to be around during that time. So I think that being humble, being a person you can interact with, and being someone that's fun to be around while you're in the trenches of residency goes an extremely long way. And I think is arguably just as important as your grades and things like that.
Yeah. Yeah. Well said. And I want to ask you one more thing before we dive into your experience as a resident.
Yeah.
Did you have any mentors along the way that had a strong impact on you? Share a little bit about that.
Yeah, absolutely. I think in each stage of my career, from starting even in high school all the way to now, I think I've had mentors at different stages. And I think one of the things too is people think that mentors have to be people that are like 20 years older than you, are already well accomplished in life. And I had mentors that were like that, but I also had mentors that were 2 years, 1 year older than me, that were associated and very well understanding of the process and where I wanted to be. And so like I mentioned earlier in high school, the guy's name's Chris Myers. He was the the strength and conditioning coach, and he was also the biology teacher. He's the first person who started it, and he said, you need to like go and do medicine or do something in science because this you have a knack for this. And then throughout undergrad, I had mentors in my research labs, and then I also had mentors in the clinical side, the ones who first gave me my first clinical exposure. I'll name drop them. Dr. Robert Hollis, he's a neurosurgeon. Dr. Sean Logan, a neurosurgeon. Anabal Lugo, Jatinder Paddy. These were all guys who were neurologists and neurosurgeons in this practice that said, if you're interested in this, we're going to let you learn as much as possible. And I think that was just, I was awestruck by this. They were teaching me everything. And, at 20 years old, I barely knew what a neuron was at that time, but they were teaching me, how to do reflexes. They were showing me how to do a sterile procedure for cases. They were showing me imaging. And I was just like, man, this is crazy. They're doing this for some kid who just thinks he wants to go to medical school, because there's a lot of people that think they want to go. And then, once you get into medical school, you have your mentors through research, the ones that help you. I worked at the University of Kentucky Spinal Cord and Research Center. I was doing pediatric neurosurgery research for a summer, and I had an incredible mentor there. His name's Dr. Brandon Miller. He's now in, I believe, Houston as a pediatric neurosurgeon, and he was very, very nice, and he was, giving me research opportunities, and he was just an incredibly calm presence in the OR, and just with the research that he did, very passionate guy. And I look up to him a lot and what, he's taught me, in addition to all of my clinical, directors. I mean, the list goes on. And I think, I have mentors in different ages and different facets of what I'm interested in, and people that I've learned from, they're mentors to me. So I think that, like I said, you have mentors at different stages throughout your process. I mean, everyone will help you get to where you need to be because they know what it was like being in your shoes 2 months ago, 2 years ago, 20 years ago.
Yeah. Yeah. It really goes to show the power of having a strong mentor. It's an incredible benefit to seek those out actively and not to be afraid to find them, because people more often than not are more than happy to help you out.
Yeah, absolutely. And that's also a really good point that you make, because when I was trying to get research opportunities at larger academic institutions, having a kid from a medical student from a not large school I sent maybe 30 to 50 cold emails trying to get research opportunities, which isn't really that much, but like I thought it was a lot because I was taking a lot of time doing it. And I got silence except from one person emailing me back, and it was Dr. Miller from the University of Kentucky. And it was interesting because I sent him my resume, and he was looking at it, and he goes, yeah, you've done the stuff, you're interesting. But the one thing that I thought was really interesting is when I was in high school, I worked as a janitor during my summers. And that was what actually got him to interview me. He's like, you worked as a janitor? I said, yeah, I did school, I waxed floors and I cleaned classrooms and stuff like that. He's like, I was a janitor. Do you want to come do research with me? And so it was like, yeah. And yeah, it's one of those things. And I always say, like, I think that those work experiences and anything that you can do in life, you never know what it could turn into. So it wasn't really like my scores that impressed him. It wasn't really the school I went to. It was life experiences. And that's what got me multiple years of mentorship and research opportunities and stuff like that. It's just because I was a janitor.
Yeah, that's golden right there. That's golden. It goes to show you as well, like as long as you don't have any red flags on your application, you meet the standard, and obviously you want to shoot for excellence. But if you have solid scores, then it's more important to have like interesting life experiences beyond just sitting at your desk studying 24/7. You want to be cool. You want to have interesting experiences, things you can relate to people with. So that's a perfect example.
It's so critical. And even in my interviews, like for residency, a lot of them said, yeah, a lot of people asked about my research, which is fine. But a lot of people wanted to know about me and ask me about my hobbies. Like, you got to have some interesting hobbies. And I got asked far more about that than any of my research papers or my board scores or what clubs I was involved in and all that stuff. So I can't emphasize that enough and agree with you more, because you gotta have some stuff outside of medicine.
Yeah. So moving into your residency experience, what has surprised you most about being a resident? You are now approaching your third year as a resident, so tell us about your experience.
Yeah, so this is like a when I saw this question like really stumped me, I think, because I was like, what was I really surprised about? Like something that I never really expected. And I think this is very specific to the field of neurology. Neurology is a very nuanced field. There's a lot of very intricate pathways, as I'm sure you're going through medical school, and that's the pathways that some people love and some people just absolutely hate, and they just hate studying them. Yeah, and you never know, you can always think where the problem is, and then something will throw you for a complete 180, and you're just like, that doesn't make any sense, but it's there. And their symptoms are there. And so neurology is very nuanced in that aspect. It's a lot of intricacies to the brain and the nerves, excuse me. And I think that that's what makes it an interesting field, but I didn't realize just how nuanced it is. And it takes a lot of effort to study, and it's difficult, but it's incredibly rewarding. I think the other thing that was the most surprising, and I guess it wasn't surprising to the point I didn't know it was coming, but once you're in it, how difficult it is. It's just being in residency. I mean, you're in the hospital early mornings, late nights, and then you have to you go into one room and you give a terminal diagnosis, and then you have to go into the other one and you have to, hey, how's it going? How's your headache? Like you have to flip on and off, and that can take a mental toll on someone. And I think just the hustle and bustle of that, plus always switching, plus always answering questions for people, it's a blessing and it's a privilege, but it is tough. And then the other thing too, I think my experience prior to medical school helped this with working as a nursing assistant and an MA and things like that. But going to the field of neurology, how critical other support services are: physical therapy, occupational therapy, caseworkers, social work, MAs, STNAs, janitorial services, environmental services. All these people play critical roles in making the wheels turn of a hospital. I think it's so critically important that we appreciate those people and that we don't think we're up here and other people are down here, because they're all part of the team that make things move. Like some of the things that social work do, I could never, ever do or find out. They're so talented. Physical therapists working with stroke patients every single day and making them, feel better and get them stronger to recover. I give the aspirin and, I give the cholesterol medications. They're the ones that are making them stronger and building back that muscle memory after a stroke. So finding and seeing and observing how critical these components are to healthcare has been rewarding, but also eye-opening, because when you're a med student, you just need to know the mitochondria is the powerhouse of the cell. But, once you get to residency, everyone knows that, but you have to make sure that you're helping the patient and their outcomes. So those were the things that really shocked me or really surprised me going into residency.
Yeah, certainly. I can imagine that the nuance hits pretty hard because you have such a tremendous burden of responsibility going from student to doctor. It's like, okay, here we go. Time to figure it out. And then, of course, treating everybody with an equal respect is of paramount importance. You can't be that arrogant jerk. You gotta just be very nice, respectful, and really appreciate everything people do for you. Have you maintained a research productivity in residency, or have you focused more so on training?
For my first couple of years, I focused on the training. I think that that's important. If there are people that do both, but my goal was to become ultimately a good clinician. I wanted to make sure that, if it came down to it, if I published maybe 5 more papers in my life or even one, I wanted to make sure that I was a better clinician than anything else. So I've really been focusing on knowing the neurology, taking care of my patients, but I've been getting back into research a little bit more. My focuses are normally in vascular neurology, but I also do enjoy some neuroinfectious disease as well. And I also enjoy headache medicine, headache and facial pain. So I do have some clinical interests, but mostly in stroke. But leading up to this, I've been mostly trying to be a better neurologist. But the PGY 2 year of neurology is notoriously the most difficult. It requires the most hours. So with my very limited free time, I chose to rest a little bit and learn more from the clinical side than do some research right now.
Yeah, completely reasonable. Can you tell us what a typical day in your life looked like throughout this past year?
Yeah, so it varies. So in our program, we switch rotations every 4 weeks. So you're on a service for a month. We separate them largely based on outpatient or inpatient. So I can give those scenarios. So for instance, if I'm on an outpatient clinic, for instance, I will get there usually maybe 7:30 in the morning or so, 7, review the patient's for the morning, and maybe some in the afternoon. I like to pre-chart on them, to look through their story and make sure that when I walk into that room, I'm not really meeting them for the first time. I kind of know what's going on, and I'll work till, noon or so, take a lunch break, and then work maybe until 5 or 4. Sometimes for me, it's a little bit difficult to chart as I go along. So I write little notes, and then once I'm done, I work on my notes. It usually takes me about an hour and a half or so to finish up notes for the day. So I'm done with my day usually around 6-ish or so, and then try to go to the gym afterwards, and then my day is close to being done. I try to read up about a interesting pathology or case that I saw during the day that I might not be too familiar with, and that pretty much ends my day on the outpatient side. The inpatient side is a little bit different. We have an inpatient service, and then we have a consult service where the teams go around and see all the people that are consulted in the hospital, and we have an ICU team and a general team, so just non-ICU patients. And the consult service, you'll get there about 7. Inpatient service, you get there about 6:37. And you check on your patients or round on the patients that you were assigned on the inpatient side, or go see new consults. And you work until about 5 or so, and then sprinkled intermittently, and we have what are called short calls, where you have to leave your clinical duties a little earlier to go pick up the stroke pager. And for about 4 hours or so until the night team comes in, you are the consult person and the stroke person for neurology in the hospital. So it can get a little busy, but it's great clinical experience. And then sprinkled in on the weekends during your second year, which is the busiest, you have call shifts. So fortunately, our program this year has eliminated 24-hour shifts, but for my year, we did 24s. So you would, for instance, I get there at 6:30 on a Saturday morning and see the inpatient side with the attending and a senior, and then I would pick up the pager at 11 or so, and then from 11 till 7 a.m. the next morning, I see all the strokes and all the consults, and then come 3 or 4 in the afternoon, I'm now in charge of the inpatient side as well. So it can get very busy, but that volume, it makes you so much better clinically. I love the volume.
Oh yeah.
You're just learning constantly when you're at work and always stimulated, and I think it's tough, but it makes you a better neurologist.
Certainly. Yeah. I mean, that's why they say it should be tough, because those challenges are what turn you into a stronger, more capable clinician. Absolutely. Can you share with us one of your most valuable patient experiences that you've had so far?
Yeah. So I think one of the more valuable ones that I had was when, I have a lot. Neurology is a field that I think every patient experience is very rewarding. But seeing all the stroke patients that come in with disabling deficits, we treat them with some TNK, which is a really strong blood thinner, or they go for a thrombectomy where the interventional team goes in and removes the clot that we see on the CAT scan. I think seeing people come in that are not doing well and recover with just maybe some hand weakness or a minor facial droop after that, that is just incredible to see. And I think that is one of the final frontiers, but one of the remaining frontiers that are life-changing in medicine is neurointerventional. So talking with those patients and seeing, how they're doing is so rewarding. I think that another thing too is neurology is filled with a lot of chronic conditions, MS, ALS, other conditions that are progressive. I think that having that discussion with the patients and letting them know the diagnosis is just it's a humbling experience, but it's also very rewarding, because these patients are coming to you for answers, and it's an answer that's not a good one to give. It's just a very humbling experience for them to maybe, say thank you after that. I just gave you a not good diagnosis and you're thanking me. But, it's a very rewarding experience to be that person in their lives and try to just do your best and make their lives as good as you can given their situation. And then I think one of the more interesting and more humbling experiences as well is I've seen a few 4 to 5 cases of Creutzfeldt-Jakob. I'm in my residency, which is a lot of people like to say the prion diseases. And for those listening, they're progressive. There's no cure, and people start out usually completely normal, and it's a very quick and a very aggressive down. Talking with families about that when I've seen it is just it's a very somber time, but I think those patient interactions when you're explaining to families and giving them prognosis and things like that have all been great experiences for me for learning, but also being able to just be that person in their lives and help and do anything I can. I think all those experiences are great.
Yeah, in a reverential sense, they've been great because you've learned and you've been able to help people through those challenging times. I understand what you're saying.
Yeah.
How do you maintain the curiosity and the motivation to continue improving during the grind of residency?
Oh, it's tough. There are days where you show up and you don't have any motivation. But I think that neurology is just one of those fields that is constantly changing. It's something that there's data coming out every single day. Different ways to treat patients. There's a lot in neurology that we don't know. I mean, I think you probably just saw in the news, we had to kind of, not recently, but in the past couple of years, we've been going off of the notions of Alzheimer's and what it really is. And we had to rewrite the textbooks recently on a disease we thought we knew for 30 years. And so just because of that, it's just it's an always growing field. You know, you always have to have a predilection for neurology. So I always think the brain is cool and nerves are cool. So I think that that keeps you interested. I'm also someone that likes constantly changing environments. I think that it keeps you sharp. We talk about in residency, what do you want your practice to look like? And some people say, I just want to be in the clinic. I just want to see patients in the clinic and do my thing. And other people are like, I want to be the person that's the person handling the stroke, or I want to be the person putting the catheter in to take the clot out, and anything in between. And I think I'm someone that needs constantly changing environments to keep me sharp and interested. So I want to see some in the clinic and I want to see some in the, on the inpatient side. Unfortunately, our program does allow for that. So that's what keeps me interested too. The changing environments, keeping me sharp, keeping me interested in different cases and different acuities is nice. Outside of medicine, keeping that curiosity is just, your family and your friends, trying to prevent burnout. It's hard to be sometimes really interested in your work when you're so burnt out from it. So having your friends, having your family, maintaining your hobbies to some degree, and also just seeing staff and even residents near you that are kicking butt, and you see them and you're like, wow, this is someone I absolutely want to be when I'm an attending. So seeing those people and their presence, you kind of try to emulate them and make sure that, that inspires me. I see staff at work every day and I see them walk around and I'm like, man, I really want to be that person. So you kind of, you try to kind of straighten up a little bit and you kind of, oh man, I really should start reading a little bit more.
Yeah. Yeah. Some people are just inspiring and it's like you want to do what they do and then eventually you become what they are to somebody else. It's a great cycle.
Yeah.
What are some of the habits and mindsets that have helped you succeed throughout your journey and particularly through the rigors of residency?
I think one of the things that really, I guess, habits. So there's some like practical habits and there's some like general habits. So one of the things is time management. And I'm sure you've been preached this so much throughout your career and everyone hears this in, medical school. Time management's the way you become successful, but even in residency and everything else, I mean, time management's critical. Everyone does get 24 hours in a day, but how you section that off is very important. Because, there's nothing wrong with, being relaxed on the couch watching TV once in a while. But, if you have things to do and you have to make sure that you space it out and make sure that you are on schedule, because as you get older, and I've noticed this too, your time decreases. Your time at work increases being a resident. You're in the hospital 70, 60, 70, 80 hours a week. And then that leaves another 80 at home and you got to sleep sometimes. So, making sure that you have a good plan for every single day. And I like to review it the night before, just making sure that I have everything in line for, things that I need to get done. That has been a game changer, and making sure that I've carved out a little bit of time to spend with my family and, sometimes my friends. It's just making sure. I'm a very OCD person about my schedule. So I like to make sure that my time management's good. It served me pretty well. Then the other thing too, I think, is when people go on this route, there's people who just are gung-ho, medicine, grades. And I think that that's important, but try not to lose sight of your hobbies and your interests, because that's what makes you interesting, and it can help you even be better in what you do. Because I'm sure, Curtis, you have hobbies and interests outside of medicine that make you who you are, and the things you learn from those and the mindsets and the habits you take from them, you apply to medicine. For instance, I was a power lifter in college and I was really into fitness and still kind of am. I'm getting residency kind of hinders it sometimes a little bit, but I'm still interested. The little nuances of powerlifting and the little adjustments, the 10-degree adjustments of your foot, when you're supposed to do the certain things. The little things matter. And I think that the critiquing in powerlifting, the critiquing in your hobbies can also translate to medicine, but also too, it allows you to completely disconnect. For me, when I'm in the gym, I don't even think about medicine. I don't even want to hear about a neuron. I don't want to hear about, a gabapentin. I'm just there to relax, to disconnect. And I think people in medical school and going along this route need that, because you can't always be going, 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 going. You have to disconnect, because if you don't, you're going to have a higher, risk of burnout. Another thing too, in terms of habits, this is, I guess, more practical, are financial habits. That is something that is not preached very well in medical school. And I think that that is a huge disservice. I think it's shocking. It's no secret that once you're done with training, you're going to be making a few dollars. So I think that it's important that everyone kind of get a base knowledge of finance and fit it in to your busy, medical, regimen and reading and stuff like that, because, you're going to be in pretty high tax brackets, and, they don't teach you about Roth IRAs and 401ks and all this other stuff in residency. So I think taking extra time to really hone in on that and make it a hobby of yours during residency or medical school or something like that is important, because you're going to be managing a fair amount of money, and everyone's going to, everyone thinks of the rich doctors and things like that, but you have to manage your money, because I've seen doctors that don't manage their money well, and it's not good. So I think that solid financial foundation is something you need. And then at the end of the day, like, mindsets in general, just be humble and be thankful. Like, this is a privilege to what we're doing. Going through medical school, it's a privilege to have the amount of stress that we have. And I think that that's an interesting way to look at it. People say, man, this is terrible. I hate studying every single day for 10 hours. I hate waking up at, 5:30 to do this. But it's a privilege. People are coming to you in their worst times during their lives, and they're saying, Curtis, I need help. How do you fix me? And it's a privilege to be in that position. And I think if we adjust our mindsets to that and stay humble and stay thankful for the opportunity to that, I think you stay grounded in your principles and you enjoy your job more. The other thing too is, I guess, some motivation and mindsets for medical students and undergrads, or even high school students, or whoever listening to this, is that there is a light at the end of the tunnel. And there are times where you don't think there are, deep in the trenches of studying for step one, the MCAT, whatever it may be, there is a light at the end of the tunnel. And make sure that, you keep that in mind. There are people that finish training. I think it's easier to see when you're a resident and you see your co-residents graduate and you see them get their jobs, and you're like, oh my gosh, that's going to be me in a couple of years. So, keep in mind that the days are long, but the weeks and the months are short, and there is a light at the end of the tunnel, and you'll get there. Just keep chugging along.
Yeah, those are some fantastic perspectives, really. First and foremost, I'd like to say, somebody's hardcore when they say they go to the gym to relax. That's what I'm talking about. It's a true privilege to be able to go through the grind of medical school, to be able to learn, to spend so many hours dedicating yourself to the craft, because that's what you chose to do. That's what you've worked so hard for. And you have to maintain that perspective, keep the mindset of gratitude, and remember why you were there, and ultimately to be the one for the patients who need you, instead of falling into the trap of negative thinking, which you hear, unfortunately, all too often. So thank you very much for sharing those perspectives. It's refreshing to hear those. Can you tell us something that you wish you had known before starting residency?
Something I wish I would have known, I mean, and again, like, going back to, like, everyone tells you residency's tough, but I wish I would, like, how tough it is. It's hard to know until you're in it, but really, because as a med student, you go through your rotations, and it's very tough too. I think third year of medical school is one of my toughest years of my life, because I had one foot in the clinical aspect, but you also had to have the other foot in the textbook aspect and trying to do your shelf exams and things like that. But I think the difficult part that I wish I would have known how to do better, I guess, was manage my time with friends and family while being in the hospital for 78 to 80 hours a week. I think I wish I would have done a little bit better in that and realized just how busy I would have been. So then I could have, planned things better at home, or, had better relationships with friends and things like that. And the other thing too, that goes back to it is, financial habits. I think that the time between, your fourth year in residency is an excellent time to learn and get yourself financially set. So when you go to residency, you hit the ground running. I wish I would have learned more about retirement accounts. I wish I would have learned more about student loans. I wish I would have learned more about just all of this stuff because, once you do it residency, you're busy and a lot of your free time you want to spend learning about your respective specialty. And, then you have to add on finance reading too. So if you don't know anything about finance, and it's okay if you don't, they don't teach it in medical school. If you don't know anything about it, I would recommend just reading about it once in a while, or definitely once you match. If during fourth year, just find a good book or a good resource that you like and kind of get a base and understanding of how it really works. Because it'll be some people's first times ever getting a paycheck and how to, kind of budget well and everything. I think it's critical. I wish I would have learned more going into residency.
Yeah, critical is the word. Critical is the word. That's exactly what I was going to say. It's absolutely critical to be financially literate. Obviously, I'm not in your position, but it's abundantly clear that you need to be financially literate before you enter these chapters, because otherwise you're just going to be devastated because you're not going to know how to handle it. For those of you interested, tune into The Physician's Mind. Justin Nabity, Dr. Kyle Stevenson, Dr. Frankie Davis. We talk about financial wellness for physicians all the time on this podcast. It's of paramount importance. Check those episodes out. Finally, Dr. Reardon, thank you so much for all of your insights today. I have one final question for you, sir. If you could give one piece of advice to a medical student interested in neurology or a medical student in general, what would that advice be?
Oh man. So I guess we'll go to advice to medical students in general. I have to go back to the point that we kind of hammered in on is just be thankful, be humble and thankful that you're there. There are some days that are going to beat you down. But at the end of the day, you are in an incredibly privileged position to be able to take the time to study and to eventually take care of someone when they need it most. And I think that having that mindset throughout reading your books for step one and doing your clinical rotations and things like that will keep you grounded and will allow you to be more thankful for people's other services around them. But also when you get to residency and as an attending, you never take anything for granted because it's getting more competitive and it's just a privilege to be in that position. For students interested in neurology specifically, I guess the best advice is really get some exposure to it before you would ever apply to residency. If you're ever interested, if you just think, man, the brain's kind of cool, go shadow someone, go shadow a neurologist in multiple, go shadow one in stroke or MS or whatever, or a general neurologist, and just see if that day-to-day is for you, but also the pathologies, because every physician day-to-day is pretty busy, but you want to confirm that what you're seeing in the clinic and how they're managing it is something you really want to do. It's not a specialty that I would recommend just applying to on a whim, for instance. It's something that you should really have an interest in and really, really just get some exposure to prior to applying to it if you're genuinely interested. And find a mentor to talk to about their lives, their experiences, everything involved in being a neurologist, and see if that's the lifestyle you want. It's just finding a mentor, getting exposure, and making sure that making that decision in neurology is what you want.
All right, there it is, folks. We've been talking with Dr. Taylor Reardon, neurology resident. Dr. Reardon, thank you so much for your insights and you sharing your experience with us today.
Absolutely. Thanks for having me. This was a blast. Hopefully, y'all have learned something from me, but I appreciate the time and consideration, Curtis. This is awesome. Thanks, man.
Of course. And if somebody wanted to reach you to ask you a question, where could they reach out to you?
Yeah, feel free to find me on LinkedIn. Feel free to find me on Twitter. X now. It's X. Sorry, that's very old of me to say that. And then you can reach out to me via email. I'm always on my Gmail. It's just my first and last name, taylorreardonDO@gmail.com. And shoot me an email and I'll get back to you as soon as I can.
All right. Thanks again, Dr. Reardon.
Yep, thank you.